for assistance to deploy in a long-term care home in the Opaskwayak Cree Nation in Manitoba. As they always do, our brave women and men in uniform are stepping up again to support Canadians and help provinces get the situation under control. The cases we are seeing are extremely concerning, and the federal government will continue to be there for people and small businesses every step of the way. As of yesterday, applications opened for the newly launched Canada Emergency Rent Subsidy. If you own a small business, you could get up to 65% of your business's rent covered, and that goes directly to you, not through your landlord. If your community is in lockdown, we're adding an extra 25% help for commercial rent through the new lockdown support. Combined with the rent subsidy, you could have up to 90% of your rent covered. To help with another big expense for business, payroll, the wage subsidy has also been extended until June of next year. These programs are just some of the many measures we've introduced to have the backs of business owners and workers alike through this second wave. Go to canada.ca/coronavirus to find out what supports are there for you. We know that this second wave had the potential to get really serious really fast. And we also knew that we had to be ready to do whatever it takes to get it under control. Because at the end of the day, lives are at stake. I know you get that. I know you're worried about the people around you. Last Tuesday, I got an email from Jackie in Edmonton. Jackie's worried about her husband who works in the school system. She's worried about her grandparents and parents-in-law who are in long-term care homes. She's worried about her kids. Jackie, I hear you. You're right. This is a tough time. And I want you to know that you're not in this alone. Our government's top priority is to keep Canadians safe. That's why every step of the way, we've been supporting the provinces so that they can make the right decisions for you. Our supports for businesses and for people mean that local officials don't have to choose between people's health or the economy. And we've been supporting with supplies as well. As of last week, we've sent over 300,000 rapid tests to Alberta and 444,000 face masks. The federal government has also provided $1.3 billion to the province for everything from PPE to contact tracers through the Safe Restart Agreement, with another $260 million for schools in Alberta through the Safe Return to Class Fund. And that's just some of the support we've made available for people and businesses in Alberta, just like for everyone across the country. No matter where you live, we will continue to be there for you through this second wave and beyond. Notre principale priorité.
Our main priority is ensuring Canadians' safety, whether that means buying more PPE, increasing contact tracing, or investing in research. That is what we are working on. Since last week, we have provided over 2.9 million pairs of gloves to provinces and territories, and others and more is coming. We also sent 4.6 rapid tracing tests, and millions of more are on their way. People need these tests, and they need this essential assistance out in the field. We're going to continue to do our part and provide them with the material they need over the coming months and weeks. It is essential to purchase and distribute PPE and rapid tracing tests, but it's also important to find a vaccine that is safe and effective if we are to conquer COVID-19. No later than yesterday, we got promising news about the AstraZeneca Oxford vaccine. Canada has already negotiated an agreement to receive up to 20 million doses. That vaccine is part of our spectrum of potential vaccines for Canadians. When we do have a vaccine, the right material to administer it will also be essential. Up till now, we have received over 24 million syringes and needles, and others will be delivered every week. This is all part of the strategy we set up to be ready when the vaccine is ready. We know that not everyone will be vaccinated at the same time. We're going to have to establish some priorities. But everything we're doing now is going to help us vaccinate Canadians as quickly as possible.
Safe, We need access to as many potential vaccines and treatments as possible. Today, I can announce that we've signed a deal to secure up to 26,000 doses of a therapeutic drug from Eli Lilly, with options for thousands more. This treatment was developed in partnership with Vancouver's Abcelera Biologics and is part of our support for researchers right here at home who are working around the clock to find a treatment for COVID-19. So to the scientists and researchers across the country, thank you for everything you do. Just like always, your dedication and expertise is making Canadians healthier and safer, and is building a better tomorrow. Canada is lucky to have thousands of world-class scientists and researchers. As a government, we will continue to be there every step of the way to support you in the work you do. Aujourd'hui,
Today, I can tell you that we have negotiated an agreement to reserve up to 26,000 doses of an Eli Lilly therapeutic, with the possibility of receiving thousands more. This treatment was developed in partnership with Abcelera Biologics in Vancouver, including partly thanks to the support we offered researchers that are working hard to find a treatment right here in the country. We're going to continue to support our researchers and our scientists who spare no effort to find a safe and effective treatment against this virus. I wish to thank them for everything they're doing for their country and for the whole world.
The news about promising vaccine candidates that we've heard in the past few days is reason to be hopeful. Our government has worked hard to secure tens of millions of doses, so we're prepared once a safe, effective vaccine is ready for Canadians. But we cannot be complacent now. Remember, if you catch COVID-19 this week, a vaccine in the coming months won't help you. We've seen restrictions increase across the country over the past few days, and Canadians are taking extra care to stay home. But I want to remind you, nothing that we do today will bring the numbers down this week. This week's numbers were already determined by behaviors last week and the week before. What we can affect today is what our country looks like a week, 2 weeks from now. So continue doing your part to keep yourself, your family, and your loved ones safe. Stay at home, wear a mask, avoid social gatherings, especially indoors, and don't forget to download the COVID-19 app. It's easy, free, and quick, and it's incredibly powerful. Just ask Sasha from Toronto. Sasha downloaded the app, and 2 weeks ago, it notified him that he'd been exposed to someone who tested positive for COVID-19. Sasha always wears his mask, sanitizes everything, and felt just fine. But he did the right thing and went in to get tested. Well, the test came back positive. He'd been asymptomatic the whole time. If Sasha hadn't had COVID alert, he would never have known. But because of the app, he found out and then was able to self-isolate and keep other people safe. He and his family are almost done their self-isolation, and they've said that they want everyone to know about their story so that as many people as possible use the COVID Alert app. To Sasha and his wife, Kate, thank you for doing the right thing in getting the app, getting tested, and then staying home. And thank you for sharing your story to encourage even more people to make the smart, responsible choice that you did. The more people download this app, the stronger it becomes. So join the over 5.4 million Canadians who, like Sasha, have downloaded the COVID Alert app. Plus les gens téléchargent cette application,
The more people download this app, the stronger it becomes. So join the over 5.4 million Canadians who, like Sasha, have downloaded the COVID Alert app. Yesterday, I had the opportunity to speak with students from the St. Martha Catholic School in Kingston, Ontario, with our local MP, Mark Garretson. I would like to conclude today by directly speaking to teachers and support staff who help us educate our children during this crisis. I know this year has been difficult. I know you're going to continue to do everything you can to help our children, to educate our children. But it's really not easy. You're placing yourselves at risk, but you're going beyond everything to support our children and their parents. Thank you. I know what kind of commitment that requires. I know what you're doing as teachers. I know what you do as teachers, and I assure you that all Canadians are profoundly grateful to you. Please continue your excellent work. Continue to be there for us, as we will be here for you. Thank you. I would be pleased to take your questions now.
Prime Minister, we'll start on the phone with questions. One question, one follow-up. Operator.
Merci. Première question, Raymond.
Thank you. First question, TVA. Question. Hello, good morning, Prime Minister. When it comes to vaccines, your government talked about the first quarter of 2021, but other countries like the U.S. are talking about possibly having a vaccine even at the beginning of December. Can you please tell us when it's going to begin in Canadians, and what can you tell Canadians who are thinking they're going to see Americans being vaccinated before we are? Answer. As people may know, we do not have mass production capacity for vaccines in Canada. We did decades ago, but since that time, we no longer have domestic capacity. Other countries that do, such as the United States, Great Britain, Germany, and others, of course, are going to prioritize access to vaccines for their own citizens first. But that is why our government did two things. Firstly, we are investing to redevelop a pharmaceutical industry here in Canada so that we can produce vaccines in the coming years, especially if ever there is another pandemic such as this one. We won't be caught short-handed as we did this time. And secondly, that is why we worked so hard to ensure that Canadians and Canada would have access to a vaccine. So we signed more agreements for more vaccines, for more millions of doses than practically any other country. And we will be here to ensure that Canadians do receive vaccines. We are working with those companies, with partners, to ensure that we receive them as quickly as possible, because we know we're not going to get through this pandemic without a vaccine, and we're working on it.
I think one of the things to remember is Canada no longer has any domestic production capacity for vaccines. We used to have it decades ago, but we no longer have it. Countries like the United States, Germany, and the UK do have domestic pharmaceutical facilities, which is why they're obviously going to prioritize helping their citizens first. So Canada did two things over the past months. First of all, we've begun to invest once again in ensuring that Canada will have domestic vaccine production capacity, because we never want to be caught short again without the ability to support Canadians directly, and that will be in place in the coming years. If ever there is another pandemic, we will not be caught on the wrong foot again. But secondly, that's why recognizing the challenges we had around getting vaccines from other countries to Canada, the Canadian government signed a record number of agreements with vaccine producers, potential vaccine producers around the world. We have reached out and have actually one of the very best vaccine portfolios of any country around the world, with far more doses for Canadians potentially than we actually have Canadian population. That's because we don't know which vaccines are going to be most effective, which ones are going to arrive early, but we have done everything we can to ensure that Canadians get these vaccines as quickly as possible and as effectively as possible. But of course, in all cases, we are in for, as a world, a number more months where we have to do everything to keep our cases down before vaccines get here, so that we are able to get through this as best as possible, which is why people need to continue to stay safe and limit the spread of COVID-19.
A follow-up question? Yes. With respect to the French language, Quebec is going to announce its intention to have its businesses follow Bill 101. Last week you said that you supported what Bill 101 was doing in Quebec. Are you going to allow that to happen at the federal level as well? We're going to see what's going to be necessary to protect the French fact in Quebec and everywhere else in Canada too. We've always cared about protecting the use of French and protecting official language minority communities across the country. We are going to take a look at Quebec's proposals. I think it's important to emphasize how much we wish to work hard to protect French. That's what we've emphasized in the speech for the throne, in the throne speech, and we're going to take a look at Quebec's proposals and make our own decisions afterwards.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, sir. Also on the vaccine front, there's been some confusion about exactly when your government will be ready to distribute vaccines. I know you can't say for sure when you'll actually have them, but when will the government be ready to distribute those vaccines to provinces and territories, and will the military be involved in that distribution?
I think everyone is rightly focused on vaccines because we know that without a vaccine, we don't get through this pandemic. And we are looking forward to being able to vaccinate Canadians in the coming months. We know that in order to know exactly which vaccines are going to be effective, we're going to have to watch the trials carefully. We're going to have to see the approvals process. We're going to have to set up logistical streams to be able to deliver those vaccines to Canadians. And those are all things that we're working on right now. But one of the reasons why we signed a range of agreements for vaccines with many different companies is because we know that not all vaccines are going to be equally effective. Some may face challenges around production and delivery, and we wanted to make sure that we were covering all the bases to ensure that Canadians would get them as quickly as possible and have them be as effective as possible. So we are working with a number of partners, including the Canadian military, to ensure that as soon as vaccines arrive and are deemed safe, they will be distributed to Canadians. We're making sure that we have the plan in place to move as quickly as possible, but it is premature to start, crossing out, circling dates on a calendar or saying that this vaccine is going to arrive in this amount on this day in this community, because there's still a lot of work to do between now and then. But we're on it, just like we've been on every element of protecting Canadians in this pandemic.
I think I understand why people wish to know more about vaccines as quickly as possible. It's like at the beginning of this pandemic, everyone wanted to know when we were going to lift restrictions during the first wave. People want to know when will these vaccines will arrive, when we can get back to normal. The reality is, there are quite a few potential vaccines, but we do not know which one will be the most effective, which ones will arrive first, when we will be able to deliver them directly to Canadians. And that's why we are currently implementing a robust plan to mobilize our resources so that we can deliver vaccines to the right people as soon as they arrive in Canada and are deemed safe for Canadians. So we have a plan. We are delivering on that plan, but there is work that remains to be done before the vaccines arrive and are distributed.
What you're saying about not being able to circle dates on a calendar because we don't know exactly when the vaccines are going to arrive or how effective they're going to be, but doesn't it make sense to have a specific date or a specific timeline in place when you'll have your rollout plan ready to go? Whether or not the vaccine is here yet, but you have the logistics ready to go to handle the vaccine. Say it should arrive earlier than we're expecting.
We are working very closely with the provinces, with partners, including the Canadian military, to establish that logistical mobilization plan, and we will have more to share as we get it up and running.
Thank you. And we'll take one more call on the line. Operator.
Thank you. Merci. Prochaine question, l'inaudible.
The next question is from Canadian Press. Go ahead. Question. Hello, Mr. Trudeau. I also would like to come back to the issue of vaccines. I didn't quite understand your explanation for my TVA colleague. You're saying that it's normal for Canadians that can produce vaccines prioritize their own populations. So are we to understand that the contracts you negotiated to buy millions of doses, and you're saying that we will, does that mean that we'll only receive those millions of doses after the Americans or the Germans or whomever, depending on the pharmaceutical company that sold it to us, will have received theirs? Answer, absolutely not. No, we will we will receive doses in the first months of the coming year. But the very first doses, and that's understandable, an American pharmaceutical company will begin to distribute in the U.S. before they distribute internationally. But we don't have to wait for everyone in the U.S. to be vaccinated before we begin to vaccinate Canadians. We will be receiving vaccines in the coming months, even while they are distributing them across the U.S. and elsewhere in the world.
Yes, the very first vaccines that roll off an assembly line in a given country are likely to be given to citizens of that particular country. But shortly afterwards, they will start honoring and delivering on the contracts that they signed with other countries, including with Canada. We've secured millions of doses of the vaccines, of the various vaccine candidates around the world, and we're expecting to start receiving those doses in the first few months of 2021.
Follow-up question? Yes, thank you. Friday, you were asked if you were angered or unhappy to see that Mr. Legault was allowing people to gather from December 24th to 27th. You were saying, and you said, no, it's fine. He can do as he wishes. And then Dr. Tam this morning said that gatherings over the holidays should only be done with members of one's own household. Can you explain the contradiction between what you said Friday and what the federal authorities are saying today? Answer. What we're always saying is to listen to listen to your public health, your local public health directives. Of course, directives are going to be different at the Atlantic bubble from those that they will give in Montreal or that one might hear in Alberta or BC. But at the same time, we are trying to guide people as much as possible using the best recommendations we have to offer. And that is why Dr. Tam is establishing principles that shouldn't really surprise anyone, that as much as possible, people should stay at home, they should avoid gatherings and social contact with people. Now, different jurisdictions are going to make their own specific decisions, but recommendations will always apply everywhere to be careful over the coming months, because we must massively reduce this outbreak of COVID-19.
It's Annie Bergeron-Oliver from CTV National News. I'm also going to go back on vaccines. I'm just wondering, what guarantees do you have from the pharmaceutical companies as well as from our allies that the delivery of vaccines to Canada will not be significantly delayed because of mass vaccination programs in other countries who've approved these vaccines first? And also, will Canada start receiving shipments before the vaccines themselves are approved in Canada so that they can get out to Canadians?
We have signed strong contracts with various vaccine companies, and we are working closely with allies on ensuring that there is a free flow of delivery of contracts. We know that this is a preoccupation that many people have, which is why it was something that we all talked about on this weekend's G20 virtual summit. It's really important to ensure that everyone gets access to vaccines around the world, because no one place gets through COVID-19 until all places are done with COVID-19. In regards to the question on vaccines arriving, we are working as quickly as possible with the data that vaccine companies are providing us to ensure that approval of these vaccines happens rapidly, so that there is no delay between them arriving and being distributed to Canadians. But we will not cut any corners when it comes to protecting Canadians' safety. We're looking very carefully at what our allies are doing in terms of approval of various vaccines, but at the same time, we know how important it is that as many people as possible get these vaccines, which is why we need to guarantee to Canadians that they will be safe for them, so as many people as possible will get the vaccines. Okay.
I think we all understand that it's important to be able to have vaccines available everywhere in the world, because no place can get through COVID-19 if everyone isn't getting through COVID-19. That's why we're trying to ensure that these contracts are respected, and we are working with our allies to that end, and we are confident that there will be no interruptions in that respect. At the same time, it's very important to ensure that those vaccines are approved for use as soon as they arrive in Canada, so that they can be distributed. That's why we're working ahead of their delivery, so that we can ensure their safety and efficacy. And Health Canada is currently analyzing all data provided by the companies in making their decisions. And we're also looking at what our allies are doing in that regard. However, I'd like to reassure Canadians that if a vaccine begins to be distributed in Canada, it is because we have deemed it safe for Canadians. We need people to feel confident and know that they are safe when they take that vaccine. That's exactly the work that we are doing to ensure that as many people, as many Canadians as possible can take the vaccine.
Canadian Press. You've criticized the opposition for suggesting that you're somehow using this pandemic as cover for major changes to Canadian society, the economy. And you've also talked about the importance of building back better. Meanwhile, we're seeing big changes, accelerations in how we're living, moves towards things like online shopping, while local merchants say they're suffering. So how do you balance supporting people through COVID-19 with what you say is this need to come out with a country that's going to be different than it was before?
I think we're learning lessons through this pandemic about how important it is to be there for each other, to support each other. I think we're learning lessons about how important it is to support a digital transformation of our economy, while at the same time we're making sure that small businesses benefit from it. I think we're learning through this pandemic that vulnerable people who are always falling through the cracks need more supports than we've been able to give them up until now. These are things that are obvious during this pandemic that I think Canadians expect the government to respond to. So, like I said, we will be there every step of the way to do whatever is necessary to support Canadians through this pandemic, and we will continue to work with Canadians to ensure that when the economy comes roaring back at the end of this pandemic, it does so in a way that benefits everyone.
Good afternoon, Prime Minister Marc-Andre Cossette with Global News. The United States, Germany, and the United Kingdom have all said that they could start vaccinating their populations as early as next month. Spain plans to have more than 10 million of its citizens vaccinated by March. You've talked about distributing the vaccine to high-priority Canadians in the first 3 months of next year, but compared to these other countries, how much longer will average Canadians have to wait to be vaccinated?
We have secured tens of millions of doses of many different types of vaccines, exactly to ensure that we're able to vaccinate as many Canadians as possible, as quickly as possible. We recognize the disadvantage that Canada has of not having a domestic pharmaceutical industry able to mass produce vaccines. But that's why we went above and beyond in securing access to more doses per capita than just about any other country of the potential vaccines out there.
Hi, Prime Minister. Tom Perry with CBC. You know, we saw in the first wave that it was the Wild West when it came to Canada getting PPE, other countries as well. And I'm wondering if this time you're talking about us securing these vaccines, but have you got assurances from our allies, from the pharmaceutical companies, that there's not going to be, say, export controls on these vaccines once they're produced that's going to get in the way of Canadians getting these vaccines?
We obviously learned a lot and had certain challenges on delivering PPE in the spring, because it was, as you say, a real challenge and lots of global competition, which was why at the same time as we managed to deliver massive amounts of PPE to Canada, we developed domestic industries at the same time. So we have made in Canada solutions. At the same time, we worked with our partners to ensure that when we saw challenges around delivery of 3M products, for example, we worked closely with the United States to emphasize the integration of our supply lines that flow back and forth across the border and ensured that essential supplies continue to be delivered. As a world, we are very aware and discussing the challenges around the necessity for free flow of goods across the borders, particularly medical supplies and vaccines. It was a topic of discussion this weekend at the G20, and we've all committed and understood that no one place gets through this pandemic until all of us get through this pandemic, and I'm confident that we're going to be able to access the necessary vaccines for Canadians across international borders.
Bonjour, Monsieur Trudeau. Thomas Laberge de Radio Canada.
Hello, Mr. Trudeau, Radio-Canada. Concerning Huawei in Canada, our allies in the Five Eyes have already made a decision on the 5G networks. We know that your government have been thinking about this for about a year. So what are you lacking in making a decision about Huawei in Canada? Answer. Our security agencies are assessing the situation, are analyzing, looking at the situation in order to make the right recommendations to government. So we continue to work with them, and we will listen to their recommendations when they're ready to give them.
Our intelligence communities and services are looking carefully at the question around 5G and Huawei. As they firm up their recommendations and make them to the government, we will move forward.
Question. Are you afraid that there will be an impact on the two Michaels, for example? Answer. We're always concerned about the situation of the two Michaels that have been arbitrarily detained in China. We will continue to do everything that is necessary to bring them back to Canada and to push back against China's form of coercive diplomacy.
About the two Canadians arbitrarily detained in China, we will continue to do everything necessary to bring them home and continue to push back against China's coercive diplomacy. Merci tout le monde. Bonne journée.
Thank you, everyone. Have a great day.
All right, that is the Prime Minister of Canada on this Tuesday with his latest update and briefing for Canadians on the pandemic across this country. Many of the questions, as you heard there, about vaccines, not surprisingly, because we are starting to get more details about how other countries are going to bring in their vaccine rollouts. But he also gave us some news about a therapeutic drug by Eli Lilly, that Canada has procured 26,000 doses of that therapeutic drug, which helps treat COVID, not exactly a vaccine, but something that would help if you are ill with COVID already. Let me bring in David Cochrane and Catherine Cullen to talk more about what the Prime Minister had to tell us. David, I'm going to start with you because I know you have a little bit more to say about how some of this vaccine is going to roll out. I mean, I understand that the question came multiple times to the Prime Minister about, well, why are we having to wait? Why will the U.S. get it? But the answer is pretty clear. It's because we don't have those companies and we aren't doing mass production.
Yeah, and finally, someone in the federal government said it publicly. I mean, various ministers have been asked about this for days. The answer, you speak to officials who are working on this and spokespeople, and they'll tell you it's because drugs are being made in the United States, the UK, and the European Union. That's if you exclude Russia and China, because you don't really do business with them in a situation like this necessarily. And we're counting on our allies in the European Union, the United Kingdom, and the United States to do this. And it's cheaper, and not necessarily cheaper, but quicker and more efficient for Canada to import it. But they're going to look after their own people first, much like Canada would if Canada developed this vaccine. The questions about how it all rolls out and a level of specificity once vaccines are approved and once they get here, that's another question. That is still very much a fluid situation. People are looking for specifics on that, but there's a bunch of things that you don't know yet. First, the provinces have been asked to look at what their needs are and do a tally of their storage capacities and where they may have gaps in their deployment systems at the provincial level. And this is where the Army could come in, Rosemary, is what do you need? How can the Army help? So this is all part of that process. But if the Moderna vaccine lands first, that's a completely different rollout plan than if the Pfizer vaccine lands first, because the Pfizer vaccine needs to be kept at minus 70 degrees. The Moderna vaccine is a relatively balmy minus 10 to minus 20, I believe. It lands somewhere in there. So the plan changes depending on which vaccine were to get approval first and have delivery first, and how you prioritize it and exactly where the second wave or where the nature of the pandemic is in the country at the moment in time that the vaccine vaccine arrives, and whether the premiers insist on a per capita rollout or if they defer to a hot zone priority rollout based on what the situation is in the country at the time. So it's difficult to give specific answers when they're still procuring sort of the specialized freezers. They've bought them, but they haven't arrived yet. They don't know which vaccine is going to land in Canada first, and exactly what provincial needs will be at this particular point in time. It's interesting, though, in his earlier prepared comments, Rosie, a lot of focus on Alberta, an email he got from a woman in Alberta who's worried about her parents, worried about her in-laws, worried about her husband, and an outline of the situation in Alberta and the 300,000 rapid tests, the mass that have been sent there by the federal government. If you look at the pandemic right now in Alberta, it has more active cases than Ontario and more daily cases than Ontario, despite only having about 1/3 of the population in Alberta versus Ontario. So that shows how rapidly this is shifting and just how difficult it is to commit to a logistics firm rollout plan until all of these other variables become more clear as we get closer to the time of vaccine arrival.
Yeah, it's a difficult place we're in right now, Catherine, because we are fighting the pandemic or trying to contain it, and looking towards this ray of light in the form of multiple vaccines. And you have to wonder for the Prime Minister whether that's concerning, because if people sort of take their foot off the brake when it comes to containment because they know a vaccine is coming, then things will not get better, or they may not make it to a vaccine. And that was sort of part of his message too. But that's a challenging bit of messaging for any politician, Catherine.
I think we would hope, Rosemary, looking at the dire picture across the country, the message from health officials in various provinces that they're starting to see hospitals that are at capacity or ICUs that are nearing capacity. We would hope that it would be very clear to people that this is not the time to take your foot off the gas. At the same time, I do think today was a reality check of sorts about vaccines from the Prime Minister, making that distinction between the situation in the United Kingdom, the United States, and Germany, the UK, and the US in particular, countries that Canadians are likely to compare themselves to. I think also, though, that there is a lot of attention, and understandably, on the starting gun in all of this, right? Sure. What is the moment when we are going to have access to vaccines? We do need to think about this as a longer-term process. It is going to take months and months to get people vaccinated. I wanted to offer a couple of other caveats if we have time before public health officials start speaking. Not really anything that came up today, but from No Less Authority, Caroline Quach-Than, who is the chair of the National Advisory Committee on Immunization. She's also an infectious disease professor and a microbiologist. Children won't be vaccinated, she says, at least not to start, because there is no data on the effect of these vaccines on children. That isn't to say that they will not be vaccinated, but with the information they have right now, that's not where the focus is. Also, she said there is a real misconception out there. We do not know that these vaccines will be able to mitigate transmission. What we know is that they protect, the data suggests they protect from symptomatic and acute illness. That is obviously incredibly important, particularly when we look at the state of hospitals across the country. But again, I think people do look at this. We all want hope right now with a troubling picture in so many places across the country, across the world. Vaccines provide that hope, but we need to be realistic about the complexity of doing all of this, the amount of time it is going to take, and the point from the Prime Minister today, how long we will have to wait. I also thought it was significant to hear him refer numerous times to the ongoing conversations with allies in an effort to ensure, and he was very reassuring in his message, but he said, we are concerned about this. We are speaking with our allies. It is obviously something that is a concern for the Canadian government, ensuring that Canadians get access to these vaccines as quickly as possible, and Canadians should prepare themselves. It sounds like we are going to see Americans and the British getting vaccinated in December. For Canadians, we still don't know if it begins in January, February, March. That remains to be seen.
Yeah, one of the other things that Dr. Caroline Quach-Than told me actually on the weekend was that, contrary to what the Prime Minister just said there, is that we still don't have the data from these vaccines that have applied for approval in the United States. So, we also have to look at the data and approve those vaccines in order to make them available to Canadians here, because just because the FDA does it doesn't mean that Health Canada will be comforted with the same information.
Well, I would just say, if you don't mind, Rosemary, two things about that. One, the challenge of the balancing act that we just saw the Prime Minister try to manage on that particular front, right? This insistence, where are they, where are they, where are they? He understands, I would imagine, and people across the country may understand, that there is a whole other flip side to that, which is vaccine hesitancy, and not just on the most extreme ends of the spectrum, but I think polls have shown there are a lot of average Canadians, if I can put it that way, who say, well, it's a new thing and I'm not so sure about it. And yes, on the one hand, people want hope, but they also do need a sense of reassurance that these are going to do what they say they're going to do and that they're going to keep people safe. There's also the question about, when they get a closer look at that data, which vaccine, are certain vaccines more effective for specific populations, specific vulnerable populations, and that may also, in addition to timeline and the concerns that David just pointed out about refrigeration and sort of the logistics of it, that will also potentially play a role in what the picture looks like. So incredibly complicated, I guess, is the takeaway from all of it.
For sure. Okay, David Cochrane, Catherine Cullen, thank you for your help today. I assume we'll be back if the Prime Minister is back in the coming days. I thank you again. Thanks. So as we said, the Prime Minister taking lots of questions there about the future delivery of vaccines. There's no firm timeline. All that we do know is that Canada has a number of companies lined up and has already signed contracts with companies who have viable candidates for vaccines. And I would just also point to one other message from the Prime Minister, as he highlighted, for instance, the support that had been given to Alberta, which is expected to go into some form of lockdown later this afternoon. Premier Jason Kenney speaking at 4:30 Mountain, 6:30 Eastern, that the actions we take now will not be shown in the numbers we're going to see right away. It's going to take 1 or 2 weeks before we can get those, before we start to see our actions now reflect those numbers in the future and start to get those back under control. We are going to take a short break. Is that what we're doing? Yeah, take a short break, and we will bring you to this press conference, which is Dr. Theresa Tam and other federal ministers giving us the latest briefing from their perspective. Natasha Fatta will have that for you after this short break.
Hello again, everyone. I'm Natasha Fatta. You're watching CBC News Network. Thank you for joining us on this Tuesday, November the 24th. Well, new cases of COVID-19 are mounting in Western and Central Canada. Alberta's government is expected to unveil tougher new measures today as it battles record-setting caseloads. CBC News will carry Premier Jason Kenney's update live at 4:30 p.m. local time. That's 6:30 Eastern. Yesterday was the second straight day Alberta saw coronavirus cases above 1,500. It also saw a record high of 62 cases in intensive care units. Alberta's top doctor, Dr. Dina Hinshaw, says urgent action is needed.
This is like a snowball rolling down a hill, growing bigger and faster, and it will continue unless we implement strong measures to stop. We must take action. Waiting any longer will impact our ability to care for Albertans in the weeks and months ahead.
The province is also facing mounting pressure from hundreds of frontline doctors and epidemiologists. They are calling for a lockdown to reverse the trend of rising cases. They say it is a crucial measure to help prevent hospitals from being completely overwhelmed. Dr. Noel Gibney is a retired physician and a professor emeritus at the Faculty of Medicine at the University of Alberta. He's watched with deep concern as Alberta's numbers continue to rise, and he says a lockdown is definitely needed.
It's even more necessary now. 2 weeks ago, we requested the government to consider what we called a circuit breaker, which would be a 2-week sharp, short lockdown. The difficulty is that our cases now are so high that I don't think a 2-week circuit breaker is going to be enough, and I think it'll take longer than 2 weeks to get us into a safe situation.
So, you've written that letter. We spoke to you at that time. So many physicians have joined this call. We spoke with another physician yesterday saying that the provincial government has essentially abdicated its responsibility to frontline healthcare workers. Would you say it's as drastic as that?
I think so. It's as if the provincial government kind of sat down and said, well, we really don't want this to be happening. We'll pretend it isn't happening. And that's what they've done. And the consequences are obvious in the numbers that we're seeing currently. It's time that the Premier and the government took responsibility, which is their responsibility, to safeguard the health of Albertans and to prevent the hospital system from further imploding.
We've seen a shift in the way contact tracing is going to take place in the province of Alberta. They are now no longer trying to play catch-up. Whoever contracts the virus latest, that's who they're going to try and trace back with. So is that going to be a helpful measure in terms of getting people immediately to self-isolate?
Hopefully. Again, the challenge is now that there are so many new cases. The question is whether the contact tracers will be able to actually keep up even with the new cases. And we'll see that obviously over the next week.
That was Dr. Noel Gibney speaking to us from Edmonton. Now, those mounting cases in Alberta have led to a huge backlog in contact tracing, as we were just discussing, and the system just simply can't keep up. So that's why those changes are coming into effect. Contact tracers will now work backwards, looking at the most recent cases first. They will no longer investigate positive cases dating back more than 10 days. Instead, those people will receive a text message telling them when their self-isolation is over. The switch is expected to immediately cut 3,000 cases from Alberta's contact tracing list. Dr. Darren Markland is an ICU physician at Edmonton's Royal Alexandra Hospital. He says that without that help, Alberta's healthcare system will be overwhelmed in a matter of weeks.
As an intensive care physician, you're always trying to decide who's going to benefit from care. Everyone, you can save most lives, but will you make people better? We're already making some of those decisions about very ill or very frail patients, which is part of the reasons why our beds haven't been overwhelmed. But as resources dwindle, the criteria for getting in means things that we could have saved, that could have gotten out of the ICU, those patients then become put aside for other ones who will have more benefit. That's triage, and we don't want to get there. The numbers are clear. Without any interventions, our ICUs will be overwhelmed by the end of December. And we will start phase 3 of our surge plan, which is not a standard ICU. This is basically protocolized medicine where I direct people who direct people to direct care. To be absolutely explicit, since we've lost contact tracing weeks ago, there is no room for these so-called directed measures. We don't know what we're directing at anymore. We need to get our contact tracing back, and to do that, we need a shutdown. The idea of economy cannot live in a vacuum. It needs social supports and people who are healthy to work. We need to shut things down, and we likely need to shut schools down for a period of time until we can get the numbers down.
That's Dr. Darren Markland, an intensive care physician in Edmonton. The Atlantic bubble is now officially on pause for at least 2 weeks. Prince Edward Island pulled out of the bubble at midnight, and Newfoundland and Labrador is going to do the same thing tomorrow. The decisions come on the heels of rising cases across Atlantic Canada. Earlier, officials in Prince Edward Island elaborated on their decision to suspend the bubble for at least the next 2 weeks. Dr. Heather Morrison is the province's Chief Public Health Officer.
As I noted yesterday, COVID-19 may be around our province, and it is likely that PEI will have cases related to the public exposures and outbreaks currently underway elsewhere in Atlantic Canada. In deciding to suspend the bubble, it is about balancing the risk of importation and protecting the health of islanders with supporting the economy and minimizing societal disruption. We all would like our life on PEI to continue as normal as possible for as long as possible, despite being in the middle of a global pandemic. Given the incidence of COVID-19 in other provinces, non-essential travel to and from PEI is not recommended. Examples of essential travel include medical and dental appointments, court appearances, compassionate visitation, specialized animal care, shared child custody, and delivery of goods.
Okay, let's take you back live to Ottawa, where federal ministers and public health officials are providing a national update on COVID-19.
Being accompanied by Dr. Theresa Tam, who is the Chief Public Health Officer in Canada, and Dr. Howard New, who is, and we are in contact with my colleague Anita Anand, as well as my dear colleague Navdeep Bains, and everyone will be speaking today. We will begin with you, Dr. Tam.
Bonjour tout le monde.
Good morning, everyone.
There have been 337,555 cases of COVID-19 in Canada, including 11,521 deaths. Nationally, there are close to 57,000 active cases across the country. And over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive. Yesterday, 5,713 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to over 5,050 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,000 individuals with COVID-19 being treated in hospitals, including over 415 in critical care, and an average of over 70 deaths were reported each day. Following last week's epidemiology and modeling update, it's clear that we need to strengthen our response, specifically to bring down the rapid rate of growth. We need to combine a range of public health measures with tightened prevention practices by individual Canadians. In many ways, we have more to bring to this round of the effort in terms of experience, tools, and knowledge. But things are different this time. There are more regions of the country with high infection rates, and it is clear that COVID-19 knows no bounds. Communities, jurisdictions, and whole regions that were little, if at all, impacted in the past are now seeing community spread. Some areas are experiencing very high rates of infection for the first time. Nunavut has implemented territory-wide restrictions. Some of the Atlantic provinces have seen an increase in cases, and the Prairie provinces now have some of the highest infection rates in the country and are feeling a heavy strain on the healthcare system. There has also been a change in the age trend. In the early days of this resurgence, we saw high rates of infection among young adults. Now we are seeing an increase in rates in older adults, age 80 years and older, who are at much higher risk of serious complications and death. Although it is still too early to know the impact of strengthened public health measures implemented in areas across Canada, we do know from the experience of many other countries that to be successful, a package of measures is required. It's not one size fits all. More importantly, we know that public participation is vital to success. This is why, as public health authorities implement measures to interrupt spread, Canadians are being called upon. It is safest for all of us to limit errands and outings to the essentials, limit in-person activities to our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing, frequent hand washing, wear a face mask in indoor public places, and avoid the 3 Cs: crowded places, closed spaces, and close contact situations whenever you can. As we head into the holiday season, I know that things will be different and difficult choices will be required. Let's focus on the things we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. There have been 337,555 cases of COVID-19 in Canada, including 11,521 deaths. Nationally, there are close to 57,000 active cases across the country. Over the past week, labs across Canada have tested an average of over 75,000 people daily, with 7.6% testing positive. Yesterday, 5,713 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to over 5,050 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,000 individuals with COVID-19 being treated in Canadian hospitals, including over 415 in critical care, and an average of over 70 deaths were reported each day. Following last week's epidemiology and modeling update, it's clear we need to strengthen our response. Specifically, to bring down the rapid rate of growth, we need to combine a range of public health measures with tightened prevention practices by individual Canadians. In many ways, we have more to bring to this round of effort in terms of experience, tools, and knowledge. But things are different this time. There are more regions of the country with high infection rates, and it is clear that COVID-19 knows no bounds. Communities, jurisdictions, and whole regions that were little, if at all, impacted in the past, are now seeing community spread. Some areas are experiencing very high rates of infection for the first time. Nunavut has implemented territory-wide restrictions. Some of the Atlantic provinces have seen an increase in cases, and the Prairie provinces now have some of the highest infection rates in the country and are feeling a heavy strain on their healthcare systems. There has also been a change in the age trend. In the early days of this resurgence, we saw high rates of infection among young adults. Now, we are seeing an increase in rates in older adults, aged 80 years and older, who are at much higher risk of serious complications and death. Although it is still too early to know the impact of strengthened public health measures implemented in areas across Canada, we do know from the experience of many other countries that to be successful, a package of measures is required, and it is not one size fits all. Most importantly, we know that public participation is vital to success. That's why, as public health authorities implement measures to interrupt spread, Canadians are being called upon. It is safest for all of us to limit errands and outings to just the essentials, limit in-person activities to just our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing and frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's: crowded places, closed spaces, and close contact situations whenever you can. As we head into the holiday season, I know that things will be different and difficult choices will be required. Let's focus on the things that we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Merci beaucoup, Dr. Tam.
Thank you very much, Dr. Tam and Dr. New. I now invite my colleague, Ms. Anand, to speak.
Madame Anand, c'est à vous. Mr. Anand?
Minister Anand, you have the floor.
Good afternoon. I would like to begin by thanking all of you for limiting your in-person contacts and following public health advice. We know how important it is to follow this advice to slow the spread of COVID as we await the arrival of safe and effective vaccines. I will provide a brief update on the logistics that we are implementing for Canada's COVID-19 vaccine rollout strategy. For many months, alongside our efforts to purchase vaccines, we have been preparing for the administration and distribution of vaccines. We know that vaccine distribution will be complex, especially in light of the need to transport and store vaccines at specific temperatures. We continue to work with the provinces and territories to ensure that we are prepared to securely and efficiently deploy vaccines to Canadians across this country. The process of rolling out a vaccine from a procurement perspective has 3 phases: regulatory approval, distribution, and administration. On regulatory approval, 3 vaccine candidates have begun rolling approvals with Health Canada: Moderna, AstraZeneca, and Pfizer. This process will be rigorous, efficient, and based on science, not politics. The deuxième phase.
The second phase, distribution, when we will continue to work with provinces and territories to ensure that we are ready to provide vaccines to Canadians across the country in a safe and effective manner. Last week, we negotiated a contract of more than 1.3 million with Fisher Scientific and a little less of $900,000 to ESBE for an order of 26,000 freezers that can freeze to down to minus 80 degrees. These freezers can work at minus 20 Celsius.
Is in addition to existing federal capacity in this area. Overall, we have the capacity to store up to 33.5 million ultra-frozen and frozen vaccines. We are also seeking to meet additional needs based on the Public Health Agency of Canada's requirements for more capacity. These efforts include, last week, issuing a competitive request for proposals for supplies of dry ice for use in certain cold chain transportation and storage. We expect to award contracts as a result of this competition next week.
To continue with distribution, following an invitation to qualify process, my department has also issued a request for proposal to 4 pre-qualified bidders that could help us with end-to-end logistics for vaccine delivery across Canada. We anticipate being able to award 1 or more of these contracts in the coming weeks.
Moving on to the third phase. When it comes to the final phase of administration, we have already put in place a number of contracts that cover everything from needles to the sharps containers in which syringes are disposed after use, from vials to the gauze and bandages used after injections. We have a contract with Becton Dickinson for 90 million syringes. We have contracts for 70 million gauze, bandages, and alcohol swabs. We also have put in place contracts to ensure that Canada has leading-edge equipment used to fill and finish vaccines, machines that are made right here at home in Canada. This is the 3 fill and finish machines from VanRx in Burnaby, British Columbia. In fact, to date, we have already received enough deliveries of syringes and needles to administer 24 million doses of vaccines, and we have tens of millions more en route. In other words, we will not cease in our efforts to ensure that when a vaccine is ready, Canada will be ready too. Nous poursuivons nos efforts pour faire.
We are continuing our efforts to ensure that when a vaccine is ready, Canada will also be ready.
While Canada waits for a viable vaccine, our government continues to protect Canadians by procuring quantities of masks, gowns, and other PPE, and by making sure our healthcare system has access to treatments that support Canada's response. You know already that we have procured over 2 billion items of PPE for this country. And in terms of vaccines and therapeutics, we are also working on securing promising and effective treatments for COVID. In that vein, I am pleased to announce that we have signed an agreement with Eli Lilly for an initial order of up to 26,000 doses of its antibody treatment over the next 3 months. J'ai le plaisir d'annoncer que nous avons
I am pleased to announce that we have signed an agreement with Eli Lilly for an initial order of up to 26,000 doses of their antibody treatment over the next 3 months.
Abcellera Biologics, a Vancouver-based biotechnology company right here at home in Canada that researches and discovers next-generation antibody drugs to fight infection and disease. The partnership combines Abcellera's advanced antibody therapy discovery platform with Eli Lilly's manufacturing and distribution capabilities. Health Canada granted interim authorization for Eli Lilly's treatment last week. It is the first antibody treatment to be approved for use in Canada under Health Canada's interim order to expedite the review and authorization of COVID-19 drugs. This treatment has the potential to help patients with mild or moderate COVID-19 who are at risk of progressing to severe illness by improving symptoms more quickly and keeping them out of hospital. In conclusion, from procuring vaccines to PPE to testing to therapeutics, Canada will do whatever it takes for as long as it takes to get Canadians through this crisis. Qu'il s'agisse d'achats de vaccins.
From procuring vaccines to PPE to testing to therapeutics, we will do whatever it takes for as long as it takes to get Canadians through this crisis.
Merci beaucoup.
Merci, Anita. Navdeep?
Thank you, Anita. Navdeep.
Good afternoon, ladies and gentlemen, and mes collègues, les ministres Anand et Duclos.
My colleagues, Ministers Anand and Duclos, are with me today to mark this important milestone in the fight against COVID-19.
Announced earlier today, as well as my colleague, Minister Anand, the government has signed an initial order with Eli Lilly for up to 26,000 doses of their therapeutic. And this is especially notable because the technology behind the important treatment is distinctly Canadian. The key antibody for this therapy was developed by Canada's very own Abcellera Biologics. And I got to know Abcellera early on in the pandemic as one of our first made-in-Canada solutions to respond in the fight against COVID-19. Les meilleures entreprises canadiennes offrent leur expertise.
The best Canadian companies have offered their expertise and their service to help us respond to the crisis, and Abcellera is among them.
Abcellera drug discovery technology uses innovative AI technology to search and analyze blood samples of recovered patients to rapidly find antibodies that can be used to fight and prevent viral infections. Using this innovative made-in-Canada technology, the treatment was developed from an antibody that was identified from the blood of a recovered COVID-19 patient. And in partnering with Eli Lilly, Abcellera's discovery will be brought to market, commercializing a great Canadian innovation. So this truly is Canadian innovation on full display and on a global scale. And this will help save lives. Of course, in the long run, we want to see these great Canadian discoveries commercialized and manufactured right here in Canada. That's why in May, I announced a federal investment of $175 million to help Abcelera build an antibody manufacturing facility in Vancouver. This new facility, funded through the Strategic Innovation Fund, will be the first of its scale in Canada. And it will be capable of going from a patient sample all the way to manufacturing antibodies for clinical testing. So our government is a proud partner of innovative Canadian companies like Abcelera, and we will continue to strengthen our nation's capacity to respond to future pandemics for the protection of all Canadians. Thank you very much. Merci beaucoup.
Merci, chers collègues.
Thank you, dear colleagues. Now we would be pleased to take your questions. Thank you, Minister.
Start with questions in the room. We'll take 4 questions in the room and we'll turn to the phone. Madeleine?
Hello, Minister Duclos, and perhaps Dr. New. I was wondering if the vaccine distribution would take place according to provincial population. Thank you for the question. As the Prime Minister was saying this morning, that, of course, is part of very important discussions that we are currently having with our provincial and territorial partners. We are on top of this file. As we know, it's a high priority for Canadians, and very soon more decisions will be able to be told to you. I can also confirm that we will continue our discussions with our provincial and territorial counterparts as to the operational and technical requirements. Of course, we will receive recommendations from our advisory committee on immunization to decide which populations to prioritize initially. And that continues in these discussions with provinces and territories. Question. So if I understand you correctly, the decision hasn't been made yet. So what must be taken into account? Is there a population that's at higher risk in one province? If there's a higher at-risk population in one province, would they receive a higher number of doses? Could you be a bit more specific, please? Answer. Thank you. This is Dr. New. Yes. Of course, that is a factor, the population of a province, but as you said, there are other factors that we analyze, such as the proportion of the population in each province and territory who are, as we know, part of the vulnerable population. And so there are many factors that we're taking into consideration and that we are analyzing and that we are discussing with our counterparts.
David?
Hi, everyone. David Thurton, CBC News. I know we're talking a lot about vaccines today and the new treatment, but I just wanted to ask a question about rapid tests. Several infectious disease doctors and epidemiologists are questioning Canada's lack of use of rapid COVID-19 tests. They say the approval is taking too long, and they point to several European countries that are using these tests to control the pandemic. So, Dr. Tam, why is Canada lagging so far behind when it comes to approving and using these rapid tests? Yeah.
So rapid tests or point-of-care tests have been actually utilized quite effectively in some of the more remote areas. So you're seeing it's used, for example, in Nunavut right now in the communities. Many of them are approved by Health Canada, and many of them have been purchased, and Minister Nan can sort of talk about that. And they have been provided to provinces and territories, including PCR and antigen tests. So I think certainly, I'm trying to remember the number now, it's probably close to 5 million rapid tests have been distributed to provinces and territories. We've provided guidance as well. So I think they're in the midst of trying to figure out their best use. But some of them are being deployed, for example, to the testing centers, and others might be used for more high-risk settings. So the specific implementation, though, is with the provinces and territories.
Yeah, Dr. New, maybe just
And
add
I'll
to
just jump in there. Just to provide some of the procurement aspect to the rapid tests. So in total, the Government of Canada has procured more than 38 million rapid tests for the provinces and territories. We have distributed 4.6 million rapid tests to the rapid tests. So 4.6 million rapid tests have been distributed to the provinces and territories, with more on the way. That includes 2 million for Ontario, 1.2 million for Quebec, 300,000 for BC and Alberta, and 200,000 for Manitoba. And this is exactly the same process we followed with PPE. Our job, and in particular PHAC's job, is to get this stuff out to the provinces and territories. And once they're in those jurisdictions, then the responsibility rests with the provinces to make sure they're used in those jurisdictions.
Yeah. It's Dr. New, just to build on what Minister Anand has said, that certainly when we're talking about rapid tests, I think we need to be clear that there's two types of rapid tests. There's the so-called molecular test, which is basically similar to the gold standard, the PCR molecular test that's in laboratories, and the so-called antigen test, which we also recognize from a sort of a sensitivity point of view, the characteristics are not quite as good as the PCR test. So as Dr. Tam and others have stated, we've actually received and shipped out, I think, by my figures, over 200,000 of the so-called Abbott ID now. That's the molecular rapid test. And certainly that's been used, I think, in good effect up north in remote and isolated communities. Certainly they're being used in places like Nunavut right now. The antigen test, which we recognize needs to be used as part of an overall testing strategy. We've actually published guidance. It's out there. The provinces, territories know that the specific circumstances, we've said that before, maybe for frequent testing in certain high-risk workplace settings like meatpacking plants, certainly to be used in long-term care facilities, maybe at the beginning of an outbreak investigation, and so on and so forth. So the tests have been distributed. Certainly, as Minister Anand has said, over 4.6 million tests overall have been distributed to the provinces and territories. The guidance is out there. I think you'd have to ask the provincial and territorial authorities in terms of how they're actually being deployed on the ground. Thank you.
Yes, thank you. But I'm just wondering, is that it? And that's significant. And don't get me wrong there. There are other jurisdictions, such as the UK, that have approved, from what I understand, at-home kits. So there's more that other places are doing. Are we going to see something like that? Is this the it when it comes to rapid testing, or is there more approvals? Is there more work that you guys are going to be doing at the federal level? Because it's still a big issue.
Well, the regulator is doing everything they can, and there are other rapid tests that are in the pipeline which can be reviewed. And if a manufacturer of a truly home test applies, then they will be, and they're pursuing all of this, and again, Minister Anand might have further information, is that the regulatory approvals, they will work as hard as they can, and then, the acquisition as well. So no, this has not stopped. This is not the end. The 38 million is not the end. We will continue, I think, to work as hard as we can, also on other options.
This is Dr. New. I don't just build on what Dr. Tam has said, is that certainly, the whole approach of what we call, testing, tracing, isolation is an important part of the public health approach, but it's not the sort of be all and end all, in and of itself. We're not going to test our way out of this situation. It also depends on the individual behaviors of Canadians. We've stressed that so many times. The basic public health measures, both at an individual level and certainly what governments and public health authorities may need to impose as well. So certainly, the availability of testing is one thing and needs to be used to its best advantage, but it's not going to be a sort of the silver bullet on its own. Certainly, we're also hearing situation stories of people becoming tired, and not wanting to go getting tested and so on and so forth. So those are all other aspects we need to look at as well. So, I can say the actual availability of whatever technology, be it testing or anything else, is certainly an important part of it, but it's not sort of the whole solution.
Thank you, Dr. Tam. We'll take one last question in the room before turning to the phone. I know Dr. Tam is expected to be somewhere. I think Dr. New will remain here to answer the following questions. Rachel?
Thanks. I thought you said we had 4 in the room initially, but this is Rachel Haynes here from CTV National News. I just have a question for the doctors of, can you give us an update on how close Health Canada is to approving these vaccines, the contracts that we have with Pfizer, Moderna, and AstraZeneca? How close are we to seeing those approvals?
That would be up to the Health Canada regulatory authorities. What they have done is to, special authorization from the perspective of the rolling submissions that you've heard about. So data as they become available is expected to be submitted to Health Canada. So I can't tell you the precise timing of what they will be doing. But of course, the paramount most important thing is that they are really rigorously looking at, they have to look at the data from the perspective of safety and efficacy and quality. The quality bit people may not understand as much is that depending on where the vaccine is produced, there's manufacturing quality assurances, there's even lot-to-lot reviews that has to happen as well, so further down the line. But they are also collaborating with an international coalition of regulatory authorities so that they can get that data as fast as possible. But I would not want to sort of intervene on the rigorous process that the regulatory authorities are doing. But they will be working as fast as possible. I know that will be 24/7. They've really boosted their capacity to do that.
The Prime Minister said, though, that he expects the delivery of vaccines in about early 2021. So does that kind of line up with the Health Canada timeline that you know of? Or are we going to find ourselves in a situation where Canada receives vaccines, but then we can't actually deliver them to Canadians because Health Canada hasn't approved them yet?
Well, I think, as I said, all hands on deck in terms of the regulatory review, but you want that to be done properly. Whether you can... lots of things are being done in anticipation of. So I'm sure we'll still be getting ready so that we can be, of course, if necessary, ahead of the game. But so all the pre-purchasing and logistics are done. But we want to make sure that every Canadian knows that whatever we are going to be authorizing would have undergone that rigorous process. But I think that as much as possible, people are trying to line up, the critical path.
I might just add, from a procurement process, our contracts with the vaccine suppliers.
We are